Hi, I'm Dr. Loo Yock Chon. I'm the consultant physician in Penang Adventist Hospital. Most acute COVID patients recover within 4 to 6 weeks of infections. So if the patient fails to regain his usual state of health after the expected time period, which means he continues to have troubling symptoms or signs after 4 weeks, then he is said to have long COVID. So there is no internationally agreed definition of long COVID at the moment. However, the Malaysian Ministry of Health agrees with the British definition, which classifies long COVID into 2 groups. The first one is ongoing symptomatic COVID-19, which refers to signs and symptoms of COVID-19 present from 4 weeks up to 12 weeks. And the second one is post-COVID syndrome, which refers to signs and symptoms that develop during or after an infection consistent with COVID-19 present for more than 12 weeks and are not explained by alternative diagnosis. The common symptoms of long COVID, the first one will be fatigue, which means tiredness. The second one will be shortness of breath or exertional breathlessness. And the third would be insomnia. And some other common symptoms are like cough, anxiety or depression, chest pain, brain fog or difficulty in concentration or thinking, loss of smell, loss of taste, muscle pain, loss of hair, and so on. So there are many symptoms of long COVID. Generally speaking, most patients with long COVID will recover within a few months, most of them. But a minority of them who has more severe symptoms and complications may have prolonged symptoms. So as we know, there is a wide spectrum of clinical presentations for long COVID. So for example, patients with mild symptoms may need only treatment to help them to relieve their symptoms or reduce their symptoms, such as their cough, their fatigue and pain, headache, etc. Whereas those patients with multiple symptoms or severe complications may need multidisciplinary care, which include physical, psychosocial, and other support, and also comprehensive rehabilitation to help them to return to an optimum functional status, either physically or psychosocially functional status. Well, vaccination helps to prevent COVID infection, or at least it will help to prevent severe COVID-19 infections. So in that sense, if you have less severe infection, you have less problem with long COVID. Besides that, people who has long COVID after vaccination, also the symptoms also improve. So I will encourage everyone to go for vaccination for COVID-19. Well, the advice is usual. Go for your vaccination and observe the SOP. By SOP, we mean the 3W and 3C. 3W means like wash your hand, wear your mask, watch your physical distancing. And 3C means avoid closed space, we call confined space, avoid crowded place, and avoid close conversation. So these are important to prevent COVID infection, and therefore you can prevent long COVID.